Good afternoon. I'm Rajen Naidoo. I'm a professor and a medical specialist in occupational and environmental medicine. I'm the head of the discipline of occupational and environmental medicine at the University of KwaZulu-Natal. That's located in Durban on the east coast of South Africa. If I had to choose one word to describe my hopes for the World Congress, this will be transformative. And basically by this, I mean that I'm hoping that participants who come to the Congress, who engage with the material, who engage with the other participants at the Congress, would leave the Congress with a different view about how to approach the public health challenges that we face globally and within our own countries. For me, change from this conference will basically be that the participants in this meeting will recognize the importance of community participation in healthcare and in healthcare systems. For far too often, we speak about community participation as it's almost like an add-on to the work that we do, rather than making sure that communities participate in a integrated manner. The words used these days are co-creation, etc., but in an integrated manner in how their health care is taken care of. The theme for the conference, Health Without Borders, is an extremely powerful theme. The gaps that we see, though, historically in the past years, past decades, has largely been on a number of different levels. Interaction between scientists and academics, interaction between communities and academics, particularly between the global north and global south, has been very clear. We've seen some shifts to address this problem in the recent years, but they are still very problematic. So a well-resourced global north, when they wish to address the issues around health without borders, believe the best way to do so is to look for partners in the global south and to work with those partners. But often what we have is a situation where we are, in a sense, demolish the borders, but we do so building parachutes or coming into these countries with parachutes. And what we see happening is where the well-resourced academia from the global north enter into countries in the global south where they are under-resourced to engage in projects, to engage in research, but to a large extent then leave those countries without any meaningful capacity development. In some instances, capacity development takes place. We destroy the borders once again, but we provide a mechanism by where we take the best brains of those countries from the global south to the global north without any mechanisms for them to return. And therefore, they get lost. And while you're having capacity development, you don't have capacity retention. So there's lots of issues. Health without borders is powerful, is required, is necessary, is happening, but the terms under which these is happening needs to be much more closely monitored and more closely defined. Beyond attending sessions, attendees can actively contribute to the discourse and leave the mark on the Congress through engaging with stakeholders. We'd expect at this meeting, the World Congress, you don't have just academia. You don't just have scientists. You have representatives of communities. You have representatives of other stakeholders, such as the policymakers, etc. And what I would like to see happening is that attendees find the time, find the space to engage across different geographical locations, but also across different stakeholder groupings. I would like to see scientists engage much more and come to a much better understanding of the experiences on the ground in the marginalized communities where healthcare is most needed and most challenged. I mean, for me, what's critical is, we speak about engaging with communities, but unless we encourage the organization of community structures, community-based organizations, and we're seeing this happening all across the world. In South Africa, we work very closely with community-based organizations. We've seen this at the Conference of Parties, COP30 in Belém in Brazil, where we saw communities are becoming organized to make changes, to put onto the agenda issues related to health. And that's what we as the health professionals become the technical experts. We are not supposed to tell these community organizations what is the right approach. They're supposed to tell us what, from our technical understanding of a problem, is likely to work in their communities. We can't come up with the interventions. Interventions have to come through organically from these communities through their organizational structures. And that's what we've got to encourage, build community organizations. So if I was given the microphone for the final keynote, my urgent call to action to the general public health community, based on the discussions from our Congress and from past Congresses and from other public health meetings, is basically to shout from the rooftops that health is political. I think one of the things we as health professionals, particularly those who are progressive and who recognize how health is shaped, people who work with communities, people who work with the global arena, we understand that health is strongly determined by social factors. In fact, we speak about this all the time. But I think what we do when we're speaking about health and the social determinants of health, I think we become, as the progressive health community, we become guilty of hiding behind curtains. Because the social determinants of health are essentially driven by political determinants. And by political here, I do not mean electoral politics. I don't mean we need to mobilize to get rid of Republicans that are currently in running government in the United States, or the right-wing governments that we have in certain European countries. I don't mean that, because we know that no matter how many governments you change, no matter whatever the political mandates or the political perspectives of these governments, by and large, healthcare remains the same. The needle does not shift with the change in leadership at a political level. But yet it is still political determinants. It's a question about, you have a poor community, and we say, well, that community is poor and therefore they have poor health outcomes. We know that. Those communities know that. They've known it for decades. But what drives the reason why that community is a poor community? It is political decisions. It's political inequity. It is how resources are distributed within the country. And our governments don't decide that. These are decided by major stakeholders and by major political shifts that we need to move these resources such that they become equally distributed across society. Those are political decisions that need to be made. And we as health professionals say, no, these are social determinants. How are we providing our communities? How are we providing our policymakers with the necessary tools if we argue that these are social determinants? Because if they're social, they're not going to change unless we bring about major political shifts, changing political paradigms to address these issues. In other words, how do we move to states, situations where we have a socially distributed or a socially equitable health system? It's not going to happen in the United States, for example, where vast numbers of people in the richest country in the world, vast numbers of people cannot access healthcare, irrespective of which government, whether it's Trump, whether it's Biden, irrespective, those people will continue to be denied healthcare. Yet there are systems in the world, such as we see in the Scandinavian countries, Historically, we knew that in the United Kingdom, but we know that's been eroded. And in places like Cuba, where people know that if they become sick, they have immediate access to healthcare. How do we shift that? And that is political. So that would be my final keynote if I had the microphone, shouting from the rooftops. Health is political.